All right, so we are recording this session. Again, welcome to our KIN alumni panel. It's really great to have you all back. I am going to start with some quick introductions before I give it over to you, Rick. So if you all, Mark, Ethan, Allison, could introduce yourselves, the year you graduated, your title, the organization that you're with, and if your preferred pronouns, and then Rick can kind of ask those questions, get really in depth with your journey. So Allison, I saw that you unmiked first, so if you want to start.
My name is Allison Feria. I'm URI class of 2010. Pronouns are she, her. I graduated in 2010, but during my URI graduation process, one of my interns was at Fitness Together. So I started off as an intern here, grew my role as a personal trainer, manager, and then bought the studio in 2018. So I'm going on year 4 and am on the advisory committee for the kinesiology department as well at URI. So glad to be here. Looking forward to all your questions.
Hi, Christy. Ethan, if you want to go now.
Yeah, sure. My name's Ethan. I graduated in 2015. I initially started out working in the neuro ICU after going to graduate school at Rhode Island Hospital, and now I currently work at UMass Memorial Medical Center in the medical ICU.
Fantastic. And Mark?
I graduated in 2015 from URI's undergrad KIN program. I then went on to get my doctorate in physical therapy from University of Rhode Island in 2019. Since then, I've been practicing as a doctor of physical therapy at University of Orthopedics and for the University of Rhode Island Athletic Department. I'm the PT for varsity athletics. Did my fellowship at Oxford School of Medicine, and now I serve as I'm a professor in the PT program, teaching an elective on the importance of integrating strength conditioning principles into PT practice. So.
Fantastic. Well, thank you all for being here. And Rick, if you want to take it away with some questions for our panelists.
All right, wonderful. Well, I have a class here, so we have like 40 people that are listening to you. So if they're not on there are lots of people out here, and we might have some questions. But I guess the first question I have, and well, one, it's very nice to see all of you. Thank you for stopping in and chatting with us. The first question is, and for anybody, is, what was your experience like after graduation? So right before graduation, after graduation, to make your decision on your career path. Whoever wants to go first, go ahead. Whoever unmutes first, we'll play it like that.
I'll jump in. So after graduating in 2015, I started working as an EMT, which was kind of the path that the PA prerequisites took me in. And I worked in that role for about a year before starting school a year later in 2016. So that's kind of the gist of that.
Yeah, I finished undergrad in 2015. I played college football throughout my time in undergrad at URI. Always wanted to be a college strength coach. And then my football career, I had a number of injuries that kind of limited things I wanted to do in that facet. And so I was like, oh, physical therapy would be a good blend in strength conditioning. And then when I was, thought it'd be a good way to kind of blend my two skill sets going forward. And I'm now fortunate to kind of serve that dual role for the university here with our varsity athletes. But the time in between was, there's like little levels of uncertainty, but as long as you have an end goal and vision and you're taking necessary steps, you'll get to where you want to be.
I'll go next. My decision-making process was more during my senior year at URI. I needed 1 credit in order to go into my second semester. So I convinced Heinrich Dahl to do a mini internship. So my main interest was cardiac rehab, or I wanted to go into PA school for cardiology. And so I interned at Miriam Hospital in the cardiac department, in the cath lab, and ultrasounds and echo. And then I also did a split internship my second semester in the cardiac rehab department, but also at Fitness Together. And I was also coaching ice hockey in Barrington at the time, and really just loved the coaching aspect and the athletic aspect, and bringing, athletes and clients from point A to point B, and ultimately fell in love with that. And I think that really helped my decision-making career-wise. So I would offer anybody to just put yourself out there and get as many internships as possible, and really find out what you love, and not just be in love with the titles of certain careers, but what you're actually passionate about.
Thank you. Thank you. I actually talked to Matt today, so he's going to come in and talk in a little while there. So we do have a question. So I figured this one is really relevant. So the question is, what is the inpatient setting like, and what experiences have you taken away from it? So I think more for Mark, you probably had some inpatient experience, and then Ethan, you too, in the PA realm.
Yeah, so my career to this point has been completely inpatient in ICUs, and I would say kind of generally what that is like is, I mean, it's a critical care environment. It's busy, it's fast paced, it's a lot of quick decision making situations, but also really rewarding, because when things go well and outcomes are good, everyone is happy about that. So if there's more specific questions about what inpatient work is like, I can go more into that, but that's what I would say to start with.
Yeah, just to expand on that, from a rehab standpoint, when I did my fellowship at Oxford, we'd be in the OR with the patient, say if they're getting a hip knee replacement or ACL. And so I'd be in the OR with them in the morning, just observing, 'cause I'm not a surgeon, right? So I'm more learning the surgical technique, getting appreciation for relevant anatomy, and then mobilizing that patient, just a few hours after surgery, and then also would handle their more post-op outpatient care of the time I was in England, and then teaching human anatomy to the med students. But the inpatient care, it's cool because people can progress relatively quickly. And it gives a good perspective of how resilient the human body is. You can see some pretty awful, unfortunate things, and then also within 3 days, like, wow, this person's coming back pretty well. Also, you could unfortunately see some things that are pretty heavy. So it's a little bit of a little variable. Certainly kind of makes you appreciate things, appreciate what health looks like a little more.
Thank you. So, I figured I'd ask, I know each of you, so I'll ask a little bit specific so we can get guided here. And the first one, Allison, for you, what is it like to be a female business owner, and how did that process work out from, being involved in the facility and then, taking over? What was, I guess,
loaded question.
absolutely. We want to know we want to know what it's like, so that if they're interested in it, how that went about.
Yeah, it's a great question. I think being a female in the health and fitness industry is getting easier in a sense. I think I've always had a little bit of resiliency. I mean, I've grown up playing ice hockey since I was little, playing on boys teams. So you kind of get used to being in male dominated or male centric situations or environments. So I think I already had that under my belt. So, any female who is an athlete, I think, could attest to that. I think, picking places to intern or, places to work, or people to work for or under is also extremely important. Having people on your side who have your best interest. And you can tell that right from an interview, the environment that you're going to be giving back to as a career. So I think having people like you said, Matt's going to speak in a little bit, but he was a great mentor and a great person to have on my team. And ultimately, right, he thought really highly of me and gave me the opportunity to buy his studio. So I don't know if that answers your question completely, but I think choosing where you're going to work and who you're going to surround yourself with is a huge, important step in the decision of progressing your career and where you go from there.
Can I just ask a follow-up question, Rick?
Christy knew me as a student, so.
Yeah,
Rick,
no, that's wonderful advice. Chrissy, go ahead, right?
Can I ask a follow-up question? So Allison, obviously as a kin major, and one of my favorite former students, you probably didn't get a lot of information on managing a business. So is that something, looking back, that you would have concentrated on? Is that something you learned on the job? Or is that something you're constantly learning more about? So just tell us a little bit, because being a fitness professional is one thing, right? But running a business is a whole nother ball of wax, if you will. So
Yeah,
tell us how those two things go together.
Whole other game. Yeah, I think, right, we all have history, jobs you have when you're 16, and through college. I think you start to realize, like, once you're an adult, what all of those processes have really shaped you. Customer service, and I played ice hockey, but I also coached for a very long time, and just those interactions really build resiliency or impact and shape you on how you would handle certain situations, whether they be clients happy or clients unhappy, sales. But definitely while I was a student, I transferred from Salve Regina my freshman year or sophomore year into URI. So I definitely had a lot of wiggle room with electives to play around with, and a lot of my electives, I've always had a business mindset, and a lot of my electives were focused on business law, management. I know Penny Steen had a class, I don't remember the kin number of it, but I know she definitely touched on certain points, facility design and management. But yeah, I would advise, the kinesiology department to definitely handle or have a class surrounded on management, sales, networking, and the importance of that processes. But a lot of it was definitely on the job, and some of it is just innate as well. Interpersonal skills helps and goes a long way.
Thank you.
Thank you. So now Mark and Ethan, you had a little bit different path. So with your graduate studies, there was a question, and Allison, you can answer too. But when it comes to internship process on your undergrad years, was it hard to find an internship in your area of interest? And your area of interest, but also, what led you to choose the internship that you had in order to then go on to further your studies, or what your employment was going to be after?
From a PT standpoint, I did 2 internships in undergrad. My first one was prior to when I decided I wanted to go to physical therapy school, where I did an internship with the sports, the strength conditioning staff at URI, but it was kind of weird because ever since I was a freshman at URI in 2011, like I was the athlete who was going up to my coaches, my sport coaches, being like, hey, my strength coaches, why are we doing this in the weight room? Not in a way to challenge them and be like, let's do something different. Just because I like organically wanted to know, like, hey, what's the premise behind, this velocity-based training principle we're doing, this periodization? Are we doing block? Are we doing, like, what are we doing here? Just to learn it, because we were learning it in class, and I just wanted to like better extrapolate it. And my, strength coaches were really nice, and they were like, oh, like this kid just wants to like understand this stuff better, and he's studying it. So they would always have me intern in the weight room each semester throughout my whole undergrad. And they would just like, and it wasn't for credit. It was more of just like, as a student athlete, you live down there in that athletic complex. I was like, I'm here all day anyways. Like, I might as well like help coach a team each semester. And so they would give me a different team, any team other than football, because they're like, that because you play this, what you do. And all through, I did that. And then eventually they were like, oh, you can get credit for a semester for doing this, which I did. And I was like full blown, like, hey, this is what I'm doing with a profession. I'm going to go be a college strength conditioning coach. And then I tore my ACL, went to physical therapy, and was like, oh, this is pretty neat, kind of way we can blend these two models, and did my PT internship where I did my rehab. So I was kind of landlocked, so to speak, around the URI campus for my internships because of college athletics. You can't just like tell your sport coach, like, hey, I'm just going to head out for like 4 months to go do an internship somewhere else. Like, I'll see you later. Like that's not going to work. They're just going to say, great, we'll take your scholarship and we'll give it to a different kid and good luck. So I was kind of more strapped to the boundaries of the campus. So if you're not strapped to the boundaries of the campus, even if you are, you can grow your grass where you are. You can be where your feet are, and you can make the most of your experience, right? Which I feel like I certainly did. But if you feel like you can go other places, cast a big net. Send that email to someone you don't even know all the way across the country, right? Cast a big net, because the answer is always no until you ask. Okay, the answer will always be no. Right. So if like, oh man, I want to do an internship in professional football, like send an email. If they say no, they don't answer you, it's the same thing as not sending it. Or they might be like, hey, we don't think you're ready for this, but here's a place where you would be ready for. And, because it's the degrees of two. It might not be the person you're talking to, but it's who they know. So it's not who you know, it's who knows you. So cast a big net.
So my internship experience and choice was driven by, I think, Rick. I think you recommended to me entering the cardiac rehab internship similar to Allison at Miriam. And I actually ended up doing that the summer between my junior and senior year, which opened up a semester to add on kind of extra biology classes, basically, which ended up earning me a degree in biology too. So in terms of the planning, like chronological planning, that was part of the strategy to open up more room, doing it in the summer. But then talking about why the cardiac rehab internship made sense, it was kind of one of my first experiences taking care of patients, taking vital signs, going over EKGs. I was in the stress testing area that they did at rehab. And all of that kind of is funneled more towards medicine and hospital type patients that were a great foundation for leading me into the PA profession. So those are the two kind of main factors I would note for how I ended up doing the internship and the reasons behind it.
Thank you. So we do have another question. So the question is, what's the environment like for LGBTQ individuals? And so there was a little bit extra on it, sports and athletics haven't always been open and accepting, but in your fields, do you see any issues with the acceptance of different individuals?
No. I think we should accept everyone. a better person to speak on this than me is I can look into getting his email address. And he's also a URI kinesiology alum, Anthony Pava, who's a strength conditioning coach at Brown University. Him and I were speaking at the RI-NSCA state clinic 2 weekends ago, and he gave an excellent presentation on this. I think that's the presentation he delivered is something that was probably my favorite presentation of the day. And I think he could speak more better to that topic. And if you guys want to have him on for something like that, or can get Danielle his contact information, he'd be an excellent resource in that department.
To answer that, I'll say in terms of like the hospital environment or healthcare in general, historically there's been a problem with ensuring equitable care and fair treatment of people with diverse backgrounds. I think currently there's a lot of focus on stomping that out. So for instance, we introduced ourselves here today with preferred pronouns, and I see that around the hospital currently in terms of inpatient charts on name badges. Those things are part of kind of everyday operation. And going back to my training in PA school at Johnson & Wales, I should have mentioned that earlier. I went to the Johnson & Wales PA program right in Providence. We had dedicated lectures to talk about people in the LGBT plus community in terms of, making sure they get the proper care they need and ensuring that they don't feel stigmatized again, so that they can come to you as their healthcare provider and feel safe and trusted. So that's, it's definitely a focus in training and in practice that is really important.
Yeah, I'm gonna tune in. I think it's a great question. I think as time has gone on, the curiosity or motivation to make things a little bit more equitable has definitely changed. As somebody who is part of the LGBTQ plus community in my own career, it definitely was, this might get a little personal, but I mean, I definitely came out as I was an employee where I was working. So that took years to, grow into that. But we are, so I did help create a diversity, equity, and inclusion committee for Fitness Together. So I am also on the advisory committee for that as well. And we do things in the community to help with, certain, low income and poverty and education based within our community, but also internally within the franchise. We are a franchise. We have 150 studios all over the country, and some in areas that are not as supportive as the Northeast for certain demographics. But, for current standards within, we're trying to really focus on what portion of our trainers and owners, gender specific, but also, how we identify, and then also hiring and implementation and marketing. And, I think for a long time, sometimes the fitness industry has definitely put people into categories, but also you can see it on Etsy, like bathroom signage. A lot of fitness facilities have found it, funny to put, the female and the male with dumbbells and little things like that, even within the private sector of fitness training, but definitely within the big gyms. There, it's been on the news. There's definitely been inequality. And I mean, the point of why we all get into sports, right, is to just feel like we have somewhere to belong or included. And so that's what we've tried to do with Fitness Together.
Thank you, all of you. there was another question, and it was related to sports and athletics or strength training. What types of internships would you recommend? And do you think that it's necessary to pursue grad school to be successful in that area?
If you want to work in college athletics, you're probably going to need a master's just because of the way things are going. They want to make sure people are educated to a high standard, because they don't want someone who's not educated to a high standard. And if an athlete dies during a training session, it's more of a litigious thing from the university standpoint, because that happens, unfortunately, at schools. Do I think a master's is necessary? For like the strength coaches I collaborate with daily, they all have their masters. Did they need them? I've talked with them about it, and they're like, sometimes it was helpful. Sometimes their master's isn't in strength conditioning. It's in data sciences, it's in education, it's in other variables. If you want to be a good coach and you want to be good at coaching people, you need to get your hands on coaching people. You can read about it as much as you want. You can write about it as much as you want. But if you got to get in the trenches, you got to get out there. And you got to work with populations that you're unfamiliar with. So if you want to work with, football, yeah, you have to know how to coach, college football or high school athletes that play football. But like, you also need to be really good at every other population. You can't just be a one-trick pony. You need to be able to coach that 13-year-old female how to squat, but you can't coach maybe that 13-year-old female the same way how to squat as you would your 16-year-old male, right? You have to be able to be transferable and deliver that education and movement to different people, right? And same thing in the collegiate sector. You could have two athletes on one team, right? Same sport, same demographic, and you have to coach them completely differently based on personality traits. So if you want to do that, you have to find an internship that's going to put you in a position to use practical skills over and over and over and over and over and over again. Okay. And do it in a hectic environment, because a weight room that is a team sport setting is not up to NSCA standards of like 18 athletes to one coach. A lot of times it's 80 to 90 to one coach at a time. So you have to be able to provide selective attention to each person. So those grad school programs, getting a master's and that stuff is helpful, right? Because you get a lot of hands-on coaching. They set that up for you while you're there. And yes, you'll learn more about strength conditioning and everything of that nature. But if you want to be good at the task of coaching someone, you have to coach someone.
Excellent. So here's a question. And I know it was before, and I didn't get on it because I wanted to go through a little bit more. There was a question: is there anything that you would change about your career currently? And so, I think that more refers to, going through the process of getting to where you are. Would you change anything about that or do something different?
If I had to go back and change the process or the timeline of things, I think I would take more time in between graduating in 2015 and entering grad school in 2016. I took a year off, worked as an EMT. I think that time is really important in terms of understanding what you want, preparing yourself as best you can to enter that training. And, for me, getting into PA school, I had my prerequisites, I had my experience as an EMT and other things that were requirements for getting in. But then the next step was kind of like, financially speaking, for instance, it's a big undertaking, going to school for 2 years full-time, unable to work. You really cannot work during that time. So making sure those affairs are in order. And then also in terms of life experience, maturity level, the work I do is difficult and stressful. There's a lot of hard conversations surrounding diagnoses, prognosis, etc. And so at this point, almost 4 years in, I feel well established with that, but I would not underestimate the significance of taking your time And, you know, if that's another year, another 2 years to get things straightened out and make sure you feel good about what you're about to enter into, that's okay. I've had people in my class, age 25, 35, 45. I had one of my friends was 52 years old, and it was her second career after being a teacher for 30 years. So it's okay to take your time.
I have a message from Christy. She wanted me to answer a question about the any chance I can. She said she loved the rule of two. I just want to get through this because I have to run right after I mention this to a meeting. The rule of two. So when I talk about separation of two, it's not the person you're talking to, it's who they know. She wants me to emphasize how I can see students who have a ton of book knowledge but need skills, right? Actual practical skills, even in their internship. I would say it's a student that shows up with the 4.0. They can tell you everything in the book, and you put a real person in front of them, they freeze. I don't know what to do. Like, they can't look people in the eye, they can't make eye contact, they can't shake hands. There's no interpersonal skills. You know, I'd rather have the kid with intern with interpersonal skills, right, all day long than the person who's a genius, right? Like, because at the end of the day, in healthcare, we work with people. You know, like, that's really important. Be able to talk to people, change up your personality viewpoints with different people. So sometimes I see, like, from a skill standpoint, so what your comes from trying to understand the need. You need to apply your knowledge. So the thing is, you can't just use your internship, right? You can't just purely rely on your 12 credit, what is it, 14, 16, however many credit is internship to be like, hey, I learned this great stuff in this kin program, and then I'm going to do this internship, and then I'm going to be ready. Like, you've done a suboptimal job of your own education, right? You need to find things every single semester to put yourself out there that aren't class related, because in the real world, like, opportunities aren't going to be like, oh, here, I'm going to sign up for my classes every semester. Like, I'm going to sign up for these opportunities that come my way. You got to go out and take it. You got to go out and get what you want. Like, so if you want an opportunity in sports medicine, cast a big net, get a bunch of no's. You'll get a couple yeses, you'll get some maybes, you'll get some not yets, right? Whatever you want to do, reach out. And even if it's not for credit, if it's volunteer purposes, they go, oh, we can give you a little stipend. You know what I'm saying? But if that's what you want to do with your life, then you might have to do it for free initially, particularly if it's an internship. And guess what? It probably won't be a 40-hour internship. It might just be like, hey, 2 10-hour sessions, you know, where you're rolling in twice a week for 5 hours to do something, to learn something. And then you're networking with that individual. Now you're in that person's network, right? Do something every semester. Like, for me at URI in my undergrad, every semester I was coaching in the weight room from the time I was 18 in 2011 until 2015. And then all through PT school, I still coached in the weight room because I just needed something to do other than physical therapy school. So cast a big net, and whatever you're learning, always make sure you're applying it as you go. You know, even if it's only 2-3 hours a week, it's something. It's something. Because the minute you just get surrounded by the book, that's a problem. You're setting yourself up for failure. But I got to run to a meeting, so I'll put someone out here. I think that went to Christine, a direct message. If anybody has anything, you can shoot me an email. I'll put it up here again.
Mark,
Thank you.
we appreciate it. Thank you for stopping by. All right, and so I had another question. I just want to make sure I get all these questions on here. Allison, do you want to answer if you would change anything?
If I would change anything, I don't think so. I don't think so. I don't know. It's hard looking back, and I don't know, when you like where you are, it's hard to answer that question. I think every little bit builds something, makes you who you are. Yeah, I mean, you're only in control of where you're going, so not where you've been. So no, I wouldn't change anything. except for the management classes in the kinesiology program.
Ethan, would you change anything?
I spoke about the, you know, you don't have to jump right into grad school as soon as you graduate. That was my potential change, is that taking time, making sure I'm ready to go forward with this in terms of, you know, personally, like I said, the financial aspect, and also basically from a maturity standpoint, you don't have to graduate in May of 2022 and start grad school in June of 2022. It's okay to take your time.
Well, I think we lost Rick. Happens with technology. So I'm looking at our moderator questions here. Is there any other advice that you would give our students? Anything that you wish that you knew now before graduating for these folks that might be doing so soon?
I'm back. My computer died. All right.
There we go.
All right. There we go. The plug was not plugged in properly. That's my fault. All right. Where are we? Did we have any more questions?
Now we
I've
finished
got
your last one.
All right, perfect. I've got questions. I like the answers, so we're doing well. I guess, you know, talking to both of you, I think I want to go a little bit more into the cardiac rehab portion, because you both were able to experience that. And so, you know, how do you think that helped, you know, with what you do now? Or, you know, what did you like or dislike about the experience?
I would say that experience was the first time I was exposed to an environment working with patients that involved what I'd call like a interdisciplinary team of people, with physical therapists and nurses, pharmacists were coming in to do education. There are nutritionists coming in to do educational lectures and things. And so that was a glimpse into the reality that it takes a real team of people with different approaches and different areas of expertise to make sure people are taken care of properly. That was a really significant thing that to this day is important, what I do now as a PA, and wherever you work in taking care of people, that is going to be necessary.
Being at the Miriam for the internship in the cardiology department, I mean, I loved it. It was fun. Every day was like a new scene. You know, I did stress tests, echo stress tests, echocardiograms. There was the nuclear med department. I was in the cath lab, reading EKGs. I mean, it was fantastic. But, you know, in comparison to my personality, it definitely wasn't. I mean, I would have loved it. I'm sure I would have. But it wasn't exactly who, there wasn't that personal factor. And that's, you know, that's also the reason why I didn't want to go into physical therapy either. You know, I really enjoyed the coaching process and seeing somebody from point A to point B and never really having to let them go. You know, clients will leave us, you know, for multiple reasons, whether they're traveling, they move. Well, now we do virtual training, so even if they move, we still train them. But, you know, that PT aspect is they kind of graduate out and you never get to see, you know, Blanche again or Mary again. And I've had clients since day one, came to my wedding, made our wedding bands, everything. And I think that was the biggest thing for me, is as many, you know, the people I was interning with, the professionals at the hospital were great. I just really loved the interpersonal relationships I was building with the people I was training. And I think that was the biggest factor why I didn't go into, you know, cardiology or cardiac rehab or PT.
All right. Well, I don't want to keep you guys too long, but Kristen or Christy, if you got a question, go ahead, but I'll ask one more here. So I guess, you know, and Allison, you just sort of talked about it. What's the most, you know, what do you enjoy most about what you do? And, you know, what aspects of it are difficult, but what aspects do you enjoy most about what you do that makes you want to go to work every day and that makes you want to, you know, be in that profession?
You want to go, Ethan?
Sure. So working in critical care, there's a lot of bad outcomes in terms of the people I take care of. But when there is a good outcome and people get better and they go from being, you know, close to dying and then ultimately discharging from the hospital and getting back to their regular life, that is by far and away the most rewarding part of the job. And kind of tied to that, the opposite end of that spectrum is certainly the most difficult, is when there are not good outcomes. But that, you know, that's okay. It's important to understand that that's going to happen. And at this point in my career, I've come up with, basically you need coping mechanisms to deal with that. But that's how I'd answer that question.
I think for me, I mean, I come in here nice and early every day, happy. I mean, I love the people I get to see. I help clients find themselves, find the confidence that some of them, you know, really didn't have. I mean, there's a personal aspect to personal training, and life sometimes can be a little crappy. And people go through health issues or relationship issues, or familial issues, and you really can help them through that. You know, I mean, I have multiple stories. You know, I'll share one. We, you know, got a client in about 3 months ago, and 43 years old, 2 kids, one 11, one 8, and she was falling, and did all these tests with her, you know, neuro, all these other scans, and was scared that perhaps she had early signs of MS. And this weekend she actually ran a 5K, and in the last 2 months she hasn't had any falls at all. You know, whether that is a sign of whatever, but you know, that confidence, right? And she's also right. And what Mark was attesting to, it's not who you're speaking to, but who they also know. And a lot of, right, the biggest compliment is a referral, whether it's for a job position or a client. She's referred a friend of hers with confidence issues, going through a divorce. And she also referred, right, the biggest is the person they love the most besides their children, her spouse, as well as a client. And I mean, I think that's the biggest thing is just helping people finally take care of themselves. I think generationally, people have learned how to burn the candles from both ends, right? We can probably see that from grandparents or great grandparents or even parents or even ourselves, right? Everything's kind of funnels down. But people have, stopped burning the candle from both ends and just burning it from one end and start taking care of themselves. And if you can take care of yourself, you can take care of the people better that you love the most. And I think that's, seeing that is the most rewarding part.
Thank you. So it doesn't look like we have any more questions, but does anybody else have anything to add or questions that you'd like to ask before we wrap it up then? Or Ethan or Allison, there's anything that you'd like to add of wisdom to these wonderful students going out into a difficult world?
I mean, I think, are we seniors or are we juniors? What are we?
My class is the internship class that you speak at. So like juniors a year away from graduating, something like that,
I think, whether you're extroverted or introverted, go into your internship wanting to learn, but also putting your best foot forward. Don't be afraid to share what you know, or just share your passion. It's not even what you know. It's just share the interest level and passion and be willing to help. And I think, especially somebody who's owning a business, sometimes that invigorates you. And I had an intern from URI 2 semesters ago or 3 semesters, and during the pandemic, and I think he helped me kind of just invigorate and find the passion again when all the balls are in the air, to just keep everybody employed on your team and make it through. But I think, share the passion, show your passion in your interviews as well. So if you don't get a job from your internship, or if you're moving back home and trying to find a job, that initial, right? Not everybody has to be warm and fuzzy in their initial interview. But you can definitely hear people in the interviews over the phone. There are some where I'm just like, yeah, that's not going to happen. And then there are some where, just being around that person, right? We call it, nobody's drinking age, but we call it like the 2-beer test. Like, would you have another drink, seltzer, with that person? And if you don't want to have a second one, I don't want to hire you. Just put who you are out there, what's important to you, and ask questions that are important to you. Like, somebody mentioned, the LGBTQ community. And if that's something super important to you, ask those questions to who's going to hire you. Like I kind of bounced at before, who you surround yourself with. And it's going to be your job. And it's going to, for some of you, it's going to be a large portion of your day. And who you spend that large portion of your day with, and then who you go home to, right? Let that funnel through and make it the best portion of your day, and around the best people. So that way you can go home and have that energy to be the best person there too. Because things get real, and stress gets more, right? Christy, you have kids and you just, the last thing you want is that career that you chose and not having a way out of it. That's my biggest, say for anybody.
I'll answer that in a little bit different way, and I'll focus it a little bit more on kind of the experience while you're at URI. And what I'll say about that is my path in kinesiology in undergrad was maybe a little different than the typical path where people go into physical therapy or athletic training or education avenues. And what I would say to that is, if your path might be a little bit different, the resources are available at URI for sure. So for instance, I mentioned that Rick is the one who pointed me towards the cardiac rehab internship and made sure that was the one that made most sense. There are advisors and meetings and presentations that go on all the time. Well, I mean, when I was there, that if you go to those things and make connections and learn about the opportunities that are available, it's amazing what opportunities are at URI if you go look. I'll just put it that way. So don't be afraid to get out and do all those things.
Excellent. That's wonderful advice, and we appreciate it. Kristen, Christy, any last comments, or I'll let everybody go here.
I'm just gonna say, I knew Allison as a student, and I knew she had a wonderful network of like kinesiology colleagues that she sort of like hung around with. And so I always thought it was really great that they, you know, worked together, studied together, enjoyed the material together. And it's been awesome to, you know, see her kind of like find her passion, like she said. I also think it's awesome to see, you know, former students like Ethan go into the healthcare sector and really flourish as well. So just thank you guys for being such wonderful representatives of our program and our department. And we're so happy to call you alums, and we appreciate you sharing your insight with our students so that they know that it's possible, right? So thank you guys so much. And thanks, Rick and Kristen, for organizing this for our students.
Yes, thank you, Kristen. We appreciate it. And Allison and Ethan and well, Mark, who's not here, we appreciate you coming in and sharing. That was wonderful. All right, and I'll be in touch. Absolutely.
Absolutely. Thank you everyone for coming, and we really appreciate it. Rick, we do have a couple question poll, so if some of our students can stay on, that'd be great. Rick, I'll send it to your students in an email. And it's just really to talk about, you know, program for next year. And we've done, you know, in-person events and virtual, and, you know, we want to be able to give you guys programming that works for you and meets you where you're at. So if you guys could give us a few minutes and just answer a couple of questions, we'd greatly appreciate it.
Absolutely, thank you. And yeah, if you want to send it to me, I can also send it out too, or you and we can
Sounds
go.
good, thanks. So I'm going to stop the recording and then do the poll.